Well, we're looking at a live shot of the White House tonight, the seat of executive power in the United States. But on this evening, the U.S. president is elsewhere in the Capitol, being treated for COVID-19 at the Walter Reed Army Medical Center. We want to get a better sense of what could lie ahead for him. Dr. Ali S. Khan joins us now from Omaha, Nebraska, former Assistant U.S. Surgeon General and currently a Dean at the College of Public Health at the University of Nebraska Medical Center. Dr. Khan, of course, we're not going to ask you to diagnose the president from afar, but based on your expertise, I want you to reflect on this. Yesterday, the president tested positive, and then in quick succession, he shows symptoms. He's now in hospital. Does the speed with which this is moving concern you?
Potentially, but again, we don't have all the by the way, good evening. Thank you for the opportunity. Potentially, but let's be honest, we don't really have all the facts. Some of the additional data suggests that the president actually was sick before he even took the test. So yes, correct. If you're most people, if you're testing them every day, you would find them to be positive probably 2 days before they have symptoms. But he may well have had symptoms by the time he was tested this time.
What about the notion of moving the president to Walter Reed to be in hospital as opposed to watchful waiting in the White House? Does that in and of itself raise alarms?
Not at all, and it's a very prudent decision to make sure that the president is being watched by some of the best clinicians in the United States at the current time.
We know the president's age, 74 years old. He is considered technically at least to be obese, that from his most recent White House physical. So those two things are known to make COVID symptoms worse, but on the other hand, not a smoker, not a drinker. How would you assess his risk factors?
And he's also a man, and men tend to do worse than women with this disease. So he actually has the worst risk factor, number one, which is age. So 80% of the deaths that we've seen in the United States are people greater than 65 years of age. So his risk, his absolute risk, hopefully he will do well. We're all praying for him and the First Lady to do very well. So his absolute risk is probably 50 to 100 times more than somebody else given his risk factor, risk factors, or his relative risk is higher, but his absolute risk still is very low. Remember, in the United States, we are dropping a number of people who die down to about 1%.
And we have about 30 seconds left, but we heard somebody say a little earlier, a political analyst, her experience was she felt a lot sicker in the second week than she did in the first week when she had COVID. Would we expect to see that kind of pattern for the president as well?
That's a typical pattern, and that's not the pattern we want to see. So we would like to see people sort of resolve their viral infection in the first week and not go on into the second week when they may well have this aberrant immune response that causes the cytokine storm and a more severe illness. So we hope that the president will resolve this very quickly.
I really appreciate your perspective tonight. Dr. Ali S. Khan joining us from Omaha, Nebraska.